Dr. Ghaffar, can we put this into some kind of practical terms in Egypt? Can you describe the impact on lung health in Egypt, please?
Let me be very specific about your question, and I'm not going to talk about impact of climate change on health. I'm just going to be very specific and talk about effect of carbon dioxide emission on lung.
Yes.
We have still premature, but it is there studies which might indicate that there is a direct relation between the concentration level of carbon dioxide, more than 1,000 particles per million, in the atmosphere with the lung function. And in females in particular, the lung function might be affected by this concentration of carbon dioxide. And the problem is, it's not only the females, the children also, the birth, are also affected, which might indicate this is not an adaptational change, it's a developmental one. And that's really a serious change in the lung function for people who are usually, or most of the time, are in an atmosphere where the particles or emission of carbon dioxide is more than 1,000 particles per million.
Yeah. And what are the actions that you're taking at the moment to try and actually have a solution to this?
So again, let me try to be very practical. What we are doing in Egypt, we had another study. It showed that although carbon dioxide emission in health facility is responsible for like 4 to 5% of the global carbon dioxide emission, but 40%, that's what we discovered in Egypt. From this 5% is related to the patient journey, going from the general practitioner or the family doctor to the specialized hospital, from the specialist to the lab or the x-ray or whatever, and then going back again. So what we are doing now in Egypt, there is a tremendous shift toward patient can take his care at home as long as he doesn't really needs to go to the hospital. So there is a presidential initiative which was launched by His Excellency President Fattah al-Sisi related to telemedicine, telediagnosis. We have now more than 300 telemedicine units all over Egypt in the 27 governorates related to the hospitals. So you can just be examined and seen by consultants without needed to go to the hospital and take all that journey with a lot of carbon dioxide emission.
Yeah, I'd like to stay with that health systems point for a little bit longer, because I know Dr. Ghaffar and Dr. Sal, you have considerable experience in this area. So how can health systems adapt to this increasing impact of climate change and its knock-on effects for rising use of healthcare? If we go to you first, Dr. Ghaffar.
First of all, I totally agree with Maria that we have to keep informing the decision makers and our people how serious it is, with a very straightforward phrases, no COPDs, just tell them you will not be able to breathe. You have a problem and you are heading to this situation where you will find difficulty to breathe. The decision maker should know that frequently, the population should know that frequently. The minute you got their attention, then you will start to make more green health facilities, more resilient. You will look for the adaptation of your facilities, all your health facilities, to be more environmental friendly. And that's what actually we started in Egypt, that we already get the EDGE certificate for our newcomer, all hospitals, all primary healthcare facilities, which will be the first one. We have 2 already, and starting from 2025, nothing will be built as long as it is not certified green health facilities.
The first one being community. How do we actually go about engaging the community better?
I cannot agree more with Victor that community should be a part of it. But I still emphasize that he should be aware of the problem. We should address the community with the proper way, the proper message, and to deliver it in a very clear, loud, and repeatable. We have to repeat it every now and then, 20 times a day, like Maria just said. in a clear way. This is directly affecting your health, your lover health, your baby's health, your wife, your everyone, and at the end, the community health. And you should be part of stopping that.
You mentioned education a few minutes ago. We talked about communication with both the population, but I want to talk about the communication with the education of medical professionals as well. They really need to engage in this. They need to understand the conversation that we've just been having. So as people with experience in that field, how do we educate the future of medical professionals?
Let me first try to phrase it like that. It took us 27 COPs before we can start talking about health and climate. Neither the planet or the people will wait another 27 COPs to start to take an action. The first action is to really educate through medical school, through medical workshops and seminars for all the medical staff about the direct effect between health and climate. Second is the awareness. Third is to provide suitable finance for the actions. Lastly, the integration between private, public, and community partnership.
Yeah.
That's what we can do.